Primal Wellness Podcast.
Welcome to another episode of the Primal Wellness Podcast. My name is Jess Mouneimne. I'm a pro athlete, a health coach, and the founder of Primal Wellness, where we blend ancestral wisdom with modern science to help you live stronger, longer, and with more intention. Each week, I sit down with leading experts, doctors, and thinkers in the world of functional health, fitness, and longevity to unpack what really works for building a body and a mind that can go the distance. So whether you're here to optimize your performance, rebalance your hormones, or simply age with more vitality, you're in the right place. So let's dive in. Today's guest is someone who is helping women reconnect with one of the most important and often overlooked parts of the body. It's the pelvic floor. Kirsty is a physiotherapist with a special interest in women's pelvic health, supporting women through pregnancy, birth, and beyond. Through her clinical work, website, and social media, Kirsty empowers women with education, helping them understand their bodies and rebuild confidence and reconnect with themselves in a more intuitive, informed way. In today's conversation, we'll unpack what every woman should know about pelvic floor health, not just for pregnancy or postpartum, but for longevity of movement and overall vitality. We'll explore how pelvic health influences everything from breathing and core strength to hormonal balance, and why its foundation is really what drives health and wellness overall. Kirsty, thank you so much. I'm so excited to have you here.
So just in kicking off straight from the bat, I'd love to know, what got you interested in pelvic floor physiotherapy specifically?
Yeah, it's not a very well-known area of physio. And so, people are always quite surprised when they hear about it or very relieved because, the problems they're having, that's what they need. So, I actually didn't know much about pelvic physio myself till I was a little bit further into my career. We get, and it may be a little different now. I can't talk for the universities nowadays, but I don't think it has changed. But we got very little exposure at varsity. I think there was one lecture. My colleague, who's also pelvic physio, she recalls the lecture. I don't, so that might have been one of the days I wasn't there. But where there was just a very, very small intro into the pelvis and what pelvic physio was all about. So left varsity with that traditional and very necessary view of physiotherapy and sports injuries and neuro rehab. And we did a lot of pediatrics as well and working in hospitals. So, it wasn't until I got into starting to work in a hospital. And at the time, my ex-boyfriend, his dad, was a well-known gynae in Joburg. And he often used to bring it up with me and ask, what are you guys doing with women's health? And I always sort of thought, well, what is women's health? We don't do that. And then thinking it's like when you treat old ladies who leak urine and have fecal incontinence, and it just sounds revolting. So no one will go into that ever. But he often spoke to me about how necessary it was for his postpartum patients and his pregnant patients, and coming from an older male that was, to get that input, because we often feel quite blocked there. But he was very pro rehab for women. And so it really got me thinking about it. And I worked in a very busy hospital, which funny, I always thought I'd be there in the clinical setting and in the hospitals, but it's a very different part of physio. It's very fast paced. It's very competitive. And I just wasn't seeing myself going on with that forever. So started looking more into the women's health thing, and then contacted our society, and they ran the special interest modules at that point. So in terms of physiotherapy, you can't really say you're a specialist in something. It's more that you have a special interest in X, Y, and Z. And there's like a sports special interest group. There's a neuro, there's a pediatric, there's a very common one known as OMT, which is orthopedic manipulative therapy, which is a lot of physios do that after qualification to kind of up their skills in the outpatients and backs and necks and that kind of thing. So the women's health section was sort of another part of that umbrella in our society. And at where I was at Mill Park, there was a physio there who also, she'd worked in the UK for a long time, and she also told me a lot about women's health and the benefits for, again, pregnant moms, postpartum, chronic pelvic pain. And it really started breaking down that whole, well, this isn't just for leaky old grannies type scenario. This is women's health. This could even be relevant to me in a way. So yeah, I did my courses, started my training, which took about a year. And that's an additional qualification on top of the baseline degree where we learn all the internal exams and treatments and very specific anatomy. Gee, much more than just the small lecture that was given or apparently given. Like I said, I don't know if I was there that day. But yeah, it really sort of opened me up to that. And then I started practicing. I was working in another practice at the time, so started marketing things, and then that's where I found that block. I started approaching gynaes and going out and talking about what physio could do, and really got the door literally slammed in my face. Doctors were not interested in referring. They didn't really see the relevance of the therapy. The surgeries help, the fact that it's just the way of life. Women have babies and these are complications, like, this sort of narrative. And so I actually just started building it on my own. And it was when I had my second son and actually moved into my own practice. And I don't know if it was that and me being pregnant again and maybe having my own space. And I started an Instagram account just because someone said, just do it. It's free and it's advertising for your practice. And I was like, great, I want to build this. And that's taken off with as a huge platform of information, which I never ever thought it would. And yeah, it just kind of took on from there. And it's really been women talking about it amongst themselves by word of mouth that's grown my practice, networking, having the opportunity to come onto platforms like this, which I'm so grateful about, to talk about the pelvic floor and all the different components of women's health and basically our entire lifespan and how the pelvic floor plays a role there. And that has kind of been the fundamental basis for my practice growing. And only much later now have doctors started referring and particular gynaes. I mean, my gynae person has always been great, knowing me and very supportive. But, now getting more of the doctors on board. So I always say to new physios starting out, don't start there. Go to the moms groups, go to the women's health events, find people in your industry like doulas or midwives or people that are interested in health, the health spectrum, and have a female interest. Connect with them, set up a webinar, do a little get together, and have a little women's thing or something. And that's actually by talking to the public and getting it into the hands of women is really how it will take off. And yeah, so that's kind of where it's brought me today.
That's amazing. So you mentioned something very brief where you said internal examinations, and it kind of brought back flashbacks for me of my first experience of pelvic floor physio. Luckily, I had a good gynae, and after my second pregnancy, you get to, and we can talk about this as well. This is kind of two things I want to talk about. We believe that the pelvic floor is just this thing that you need to do Kegels with, and so that you don't pee yourself when you're an old lady. That's kind of as far as it goes, or that if you do have a vaginal birth, that everything goes back to where it needs to go. That's kind of as far as, and so my kids are 12 and 14, so I'm hoping things have changed since I was in that new baby space. But that's kind of as far as the pelvic floor education goes as a mom or a young person thinking about having babies. And the general idea was that your pelvic floor is fine as long as you're having a C-section. And if you're not having a C-section, then your pelvic floor is, going to go to shit. I had 2 C-sections and thought that my pelvic floor was going to be fine. And then ended up at my gynae for a checkup, and literally between him trying to do an internal examination and, having the okay to have sex again, realized something wasn't right. Things weren't how they were a couple of months ago. And he then recommended a pelvic floor physio in Cape Town. And to my shock and horror, I had an internal examination or internal massage. And I was like, what the hell is this? But it changed my life. It was weird because I didn't know that it was a thing that existed, but it made all of the difference from thinking that, sex was never going to be an option again, that everything was just going to be sore. And that's how it was going to be, to having 2 sessions and feeling like, wow, my life has changed. So do you find that women come into your practice for the first time? Okay, let me say, are internal examinations the way that or internal therapy, the way that you access the pelvic floor? And do women have the same shock that I do when they arrive at your practice going like, this is what's going to happen?
So it's a very important question because, yes, it is a part of pelvic floor work, but I tend to approach it in a very different ways. I am very in information giving with my patients. I want patients to be empowered. I want them to understand what's going on. so that they make informed decisions based on concrete knowledge and not the sort of autonomic, yes, I'll just go through this because I have to sort of thing. So I always approach it by explaining, what the pelvic floor actually is and how it's structured, and that it's basically joints and muscles, which is what our body is made up of, except unlike the rest of our body, apart from the oral cavity, this is an internal space. So it is not a seen group of muscles and joints, which is part of the problem why people can't connect to it or don't know what it is or how it works. It's also a very personal space. As we've mentioned, it's where our sexual wellness lives. We have wheeze and poos from there, which are not socially the best. You don't just do that in front of anyone. Lot of emotional and behavioral stuff going on with bowel and bladder function. So yeah, it's a very private space. So I always like to be very informative with my patients, and usually prior to them coming to see me, they will receive a document from me just explaining a little bit about the pelvic floor, why it might have been disrupted, depending on what they've been through. It's usually trauma. And then this is why we do an internal exam, and that it's not a compulsory thing. It's just information for them to be aware of, that when they arrive and they can ask any questions. And so many patients say to me, that letter, I'm still not like completely on board with this internal thing, but thanks for explaining that, because it just helped me to just understand and be prepared for the session a bit more. And I explain everything, like, you're going to come in, you're going to do this, you're going to do that, I'm going to ask this. So they really feel like very secure the whole way. And then when they're actually in the session with me, I have loads of models and paper demonstrations and pictures, and we do a lot of visual learning, and actually then explains them physically, look, here's your pelvic floor, these are the muscles, this is how it works. And like with the pelvis like facing them, like this is you sitting facing me, and here's what's going on. And they're so fascinated by it. They're so into it because they're connecting and they're seeing what's going on, and actually like, oh, that makes so much sense now. And, a lot of women don't know that they have 3 holes in their undercarriage. They've never looked down there. So firstly, to explain, like one lady looked at me, she goes, oh, I thought everything just came out of one space. So letting them hold it, letting them have a look at it, and then explaining the treatment from there. And also just to sort of, talk about, have you ever had physio before? Did you ever hurt your back or have a headache, or, the usual stuff, the normal physio, as what some patients call it, that, and a lot of people say, oh yes, I've had a back injury, or I see another physio for this, and this. And I'm like, well, exactly. So it's muscles and joints. You have pain, you have dysfunction. So the physio needs to assess you. They need to look at where the fallout is. They need to find the weak spot. The physio doesn't just stand there and say, oh, okay, neck pain, great, do these stretches and go to the gym and do these exercises and you'll be fine. We get in, we release the muscle, we work on the pain, we adapt things. So it's exactly the same with the pelvic floor, except this is more in an internal space. And then explaining to them that it's not a pap smear, because usually the biggest problem is that there's been usually a very uncomfortable or awkward or not so nice experience down there. Anything from actual sexual assault to being abused to just going to the gynae and just not enjoying having pap smears. I mean, nobody does, but that there's that. But there's this kind of, the brain knows that, and the brain is a protective organ. So it's not exactly going to make you feel like, woohoo, let's just do this, So again, getting the brain to understand and create a safer space. So I explain to patients, I'm not a doctor and this is not a pap smear. I'm not interested in finding your cervix. And then on my models, I can actually demonstrate where my finger will go and let them, again, hold it and see. And by the time we actually get to the internal exam, I mean, patients are, it's still, they're not like, completely excited about it, but they are most definitely a lot more relaxed, more curious, more interested. And again, I say it to my patients, and saying it now, patients go into that room and it's like a magic space, and they come out a totally different person, more connected, pain-free, feeling more movement, whatever the issues that they've had, they can already feel that change and feel more empowered and that conscious connection. And even my most nervous agitated patients will arrive for their next appointment. They'll book and they'll come back, and they're almost like taking off their clothes immediately as they come in. They're like, okay, will you check my pelvic floor again? I want to see I'm doing it right. And they're just so on board with the treatment. So I think with everything, it's explaining, it's debunking myths. It's creating that safe space. It's educating people, allowing them to ask questions, allowing them to say no. And I have had patients who've said, look, I don't know if I'm very comfortable with that, or can we think about it? And the answer is sure. This is your space. This is your space to heal. You need to feel safe here. So let's start with some external muscles, some breath work, some other stretches. Again, with pelvic health, it's not only about the pelvic floor. And that's where we're going to lead into your C-section, why C-section causes pelvic floor disruption. Very common that we think, oh, pelvic dysfunction is only about those muscles. They are very important, but no muscle works in isolation. And it's a holistic whole body approach, including the pelvic floor, that is where patients really make such tremendous progress and heal. And again, where Kegels, like little Kegels on the toilet, stopping and starting urine, or, putting a Kegel ball in and holding it, or sitting on a chair that buzzes up your bum and gives you like 1,000 whatever contractions a minute. Those don't work because it's not just about those muscles. It's about emotional processing. It's about including the other core structures and accessory muscles. It's about understanding your body. It's about lifestyle changes, positional. So it's so much more than that. And so patients coming in really are given often with patients, like, it's a lot of information. I know it's very overwhelming. So let's just work on the ones that you've grabbed today, or even if it's just the breathing. Just start with something that you feel you can do, and then we take it from there.
It's a lot. It's fascinating, but it's a lot. So what are the common, and I mean, I'm probably asking you how long is a piece of string now, but what are the common reasons why women come to you? Obviously, I know there's a big focus on pregnancy and postpartum, but what are some of the symptoms, or what are the reasons why women would end up coming to see you?
Yeah, so it's a very good question, because mainly women are seeing me. The average patient is either pregnant or just had a baby, or in that early, and when I say early, we're saying sort of a year postpartum. So that's the average patients that's coming to see me. And that's really because women, that's when they figure out, oh, I've heard about this pelvic floor thing, or, now I'm pregnant and I'm feeling what's going on, or I'm having these symptoms, and they start Googling and the pelvic floor muscles are coming up a lot, or they're prepping for vaginal delivery and, talking a lot about the pelvic floor and thinking, like we just said, it's an unseen area of muscle. So, they sort of think, well, where is that? What does it do? So that's commonly where I'm seeing ladies. And even in that space, there comes like its own little subsection of problems of why they would come. But to answer generally why someone would come for pelvic physio, is the very obvious one is leaking urine. So most women start to investigate that at some point in their life. And again, we are born with a pelvic floor, and the minute we can stand up and walk, it is with us, and it is journeying each stage of our life through our childhood, which is our early bladder training and going to the toilet. That's already something. And then going into our teenage years with puberty, starting to menstruate, sexual awareness, moving through to our fertility years, childbearing years, the gap in between, where I am and you are, I don't know what we call that, where we're not childbearing, but we're not menopausal yet. So we like in between there. Yeah, that sort of time or the pre-menopause, maybe I could say, to perimenopause, menopause, and then old age. Those muscles are influenced by every stage. And so pelvic floor dysfunction can be at any time with that. So the common symptom is leaking urine, or chronic constipation. So bowel and bladder issues, pain having intercourse, or any penetration into the vagina. So usually, for an example, a woman will see me postpartum because she's battling having sex and having penetration. And when we start chatting, because now you're thinking this is very much a postpartum issue now. When we start chatting, she, tells me, well, she's never been able to use a tampon, and she thought that was normal, but she's actually never been able to put in a tampon. And then she got married, and sex has always been uncomfortable. She's never enjoyed it, but you kind of think that's normal also, and pickle along, and who has like I say, it's a personal issue. So funny, as women, we talk about a lot of things, but we don't always discuss. No one sits down at their coffee dates and say, oh my gosh, anyone else here battling with sexual function, or I leak urine all the time. What's going on there? We don't talk about these things. So actually that's an example of how we think it's very prominent to her postpartum time. Actually, her issue was there before, or she's leaking urine postpartum. But when we talk about, or she like when she grew up, how did she potty train? I mean, she obviously can't remember that. But, some people will say, no, I had to go to the toilet like before bed every night, or anytime we got in the car, my mom made me go have a wee. And already that's upregulation of the system and creating a habit in the bladder, which then presents much later. Commonly pain can also be something just in general, pelvic pain. So with endometriosis patients, a woman who possibly had trauma, an accident previously, or were assaulted or sexually abused, that they just have pelvic congestion, pelvic pain, discomfort all the time. And another one that's a common symptom, interestingly enough, is coccyx pain. So not being able to sit comfortably, or in certain positions, like a deep anal pain around the back passage, around the coccyx. They've constantly got to shift. They can't sit for more than a certain number of hours. Again, all linking into this pelvic dysfunction.
Yeah, so it sounds like what you're saying is that a lot of the work that you do is impacted by some kind of traumatic experience, whether that be an assault of some kind, or even birth in itself could be traumatic. The work that you do is somewhat emotional as well as clinical, opposed to like maybe a regular physio that you were saying, is just not necessarily going, what emotional trauma are you carrying in your traps before I release them? Maybe some physios are. But so how do you balance that?
No, absolutely. And actually, that's one of the functions of the pelvic floor that I tell my patients, is it's a very emotional space. So apart from the biomechanical structure of the base of the pelvis and the pelvic floor to give us postural support and our continence of our organs, it's our feminine anchor. It's where we find our grounding as women, and it holds a lot of emotion there. A colleague of mine often says that there's a book called The Body Keeps the Score. I don't know if you've read that. So similar thing there. So she often quotes and says the vagina keeps the score. So whatever we're going through in life and experiencing, we often harbor a lot of that in our pelvis. So it is a very emotional space. And the obvious one would be something like a birth, not even a traumatic birth by the sense of tissue damage. Birth, whether it's a C-section or it's vaginal, a completely, it's such a off the chart experience, and it changes you, and it can really like alter a lot of things. And especially in that early postpartum phase, recovering, having gone through that, it's a hugely emotional journey, becoming a mom, figuring things out, never mind all the hormonal stuff going on in the background. So we tend to hold a lot there, and the like when I say a feminine anchor, the pelvic floor is often like the last man standing, or the fallout guy, so to speak, or the designated driver. It's the one group of muscles that is consistently present for us when the world falls apart, or when there's injury and other muscles can't cope, or the body goes through a big transition and a journey like a pregnancy, and there's a lot of adaptation. Pelvic floor is a constant. It's there, and it's holding things together, and it's supporting us. And again, like I mentioned earlier, nothing works in isolation. So that's fine for that brief moment of time, but ultimately you need to let that go and rehabilitate and bring everything else back into the picture to work together. So this kind of work goes far beyond, and as physios, we are very hands-on, and there is a huge space for that tissue release. But what are we doing with the patient's nervous system? Are we assisting them with lifestyle modifications? Sometimes that's not within our scope. So I refer out to biokineticists, to dietitians, to chiropractors, to osteopaths, to TRE therapy, to psychologists, to whatever the patient needs to add into this. It's a very holistic approach for an holistic body. So it's interesting. hard because you are constantly the receiver of patients' problems, which like my patient came in today. She actually came for something completely unrelated to the pelvic floor, but she just hobbled into my room, and then I said, "How you doing? Nice to see you." And then I made a joke and I said, "Well, you wouldn't be here if you weren't in pain." Like, it's not like anybody comes here when they're happy and life's great. And she was like, "Yeah, Kirsten, I agree with you. And yeah, I'm in absolute agony." But then, with that comes a lot of psychology. So patients often offload more than just my leg is sore. It's my leg is sore, but I've had a terrible week at work and this isn't going right, or I've had a death in the family. So you often tend to be like the sort of person that is sort of the first line of interaction with all of that. And yeah, it's not easy. Physios, especially in our field, can burn out very quickly. So again, a lot of the practice what we preach is take care of yourself and make sure that you're nurturing and filling your own cup. But yeah, it's very rewarding, and seeing patients transition those obstacles and work through things that often they again also don't feel very seen, to sit and tell me that they feel this pain and this discomfort, and when they tell their doctor or they tell somebody else, they just brushed off with but you've had a baby, that's normal, or sex is going to be uncomfortable for a while. Just keep doing it, and it'll get better. It's like this gaslighting of their symptoms, and yeah, so it's definitely a narrative that needs to change.
I think that is so powerful what you're saying around a lot of the conventional medicine. So whether it's a gynecologist or wherever you end up, I feel like it is shifting. I feel like there is definitely a more of a openness and an understanding of functional medicine and who all could be practicing in that functional medicine space. But a lot of people end up with that very narrow-minded conventional doctor who maybe means well, but hasn't educated since getting their degree, doesn't know what else is out there. And then, yeah, like you said, you end up being told that maybe surgery is where you need to go, or like you said, just accept that, this is your default now. You've made a baby. So now these are just, it's okay. Like things just aren't going to work.
Yeah.
And I see it as a trainer all the time, where I work with women postpartum, women into perimenopause and menopause. And a lot of them will just say, like, I can't jump anymore because I have incontinence. So jumping is not an option. We can't do jump squats. We can't do box jumps. It's just that's they've made their mind up. And I'm even at fault of saying, okay, then we don't jump. Instead of going, have you ever gone to, have you looked at if this is something that maybe can be salvaged and fixed? Yes. Or it'll be the same thing with, women that have had vaginal delivery and have torn and are concerned about putting pressure on it. And it's just, this is it now. It's always going to be sore, or there's always going to be discomfort without going even further. So speaking a little bit more into like the pelvic floor from a longevity perspective, or functional health perspective, besides the big things that we've mentioned now in terms of incontinence, pain, that kind of thing, what else is the pelvic floor kind of responsible for from a long-term perspective?
So long-term perspective, we are looking at, and again, very undereducated stage of our lives, but and I often say to patients, you think there's not much on postpartum, wait till you hit menopause. Like there's zero information there. We need to be very cognizant of our strength training and our muscle strength. And you will definitely know all about this from your profession and your training and the industry that you're in. But it is absolutely essential that women are educated on strengthening and preserving their muscle capability, because no good thing lasts forever. And especially when it comes to us, when we go through menopause and our estrogen depletes. Estrogen is our muscle fuel and our joint fuel. It's our natural anti-inflammatory and our protector in our body. And, it's quite interesting, but in the early postpartum stage, and when I say that, it's sort of like in the first 6 months, even to a year, women are almost in that perimenopause dip with their hormones readjusting and estrogen building up again and getting that sync of their hormone flow back into a rhythm. But it will come back because they're young, and again, a fertile stage of their life. The body by nature wants to create more life. So that will circle back again and it will get better. But when you are in your 40s heading towards your 50s and there's that slow decline to a point where it becomes quite obvious because of the symptoms, there is no up again from there. That is the end of the road. That's where it's going to stop. And women are not educated enough about what they can do for themselves in the prime time of their lives to preserve and nurture, almost like we're preparing for hibernation. There's that story of the grasshopper and the ants, and it was the ants, yeah, and the ants. I'm thinking of A Bug's Life. It was that movie. The ants prepare every year and store the food for their winter, and the grasshopper doesn't, because it's just going to be this endless continuation of feasting. But they will hit that winter, and we will get there. Yeah, so very, very important. It begins with our muscle strength, because sarcopenia, which is muscle atrophy and weakness, and osteoporosis, which is brittle bones and bone weakness, go hand in hand together. And when we look at the longevity, and I'll get to the specifics of the pelvic floor in a minute, because I know that's what you essentially asked me. But again, it's a whole body process. It's not just focusing on the pelvic floor, because when we actually look at our menopause and beyond, decrease in bone strength and loss of muscle strength make women more susceptible to falling and fractures, which is actually a major health risk for us that we don't know about. And also our risk for heart attacks and cardiovascular problems also triples up, higher than men after 50. So again, another one that we are not educated about, which is where our cardio workouts and our exercise is super important in preserving that prior to that stage. And then, as you mentioned, what is the debilitating factor? So women will have incontinence or leak urine, which means that then they won't exercise, or they won't do certain exercises, which means they won't strengthen their muscles, which means they won't strengthen their bones. So they kind of go into this inactive, they may become more obese, which then leads into more of the metabolic changes that we're seeing in menopause and problems there, including our cardiovascular system, diabetes, that kind of thing. So the pelvic floor actually can be a very central point to this being more manageable, so that women can be more active and partake in certain exercises that they enjoy, get out and about, move their bodies. It's all transient. So obviously what we're doing in our 50s won't be exactly the same as what we're doing in our 30s. But that's where professionals like yourself come on board to educate and guide people to be doing the right things that their body can cope with. The idea is that we don't want things in the way that women will stand back and say, oh, well, I can't move now, I can't exercise, I can't because of this problem. Managing pelvic floor health long-term, always encourage, prevention is better than cure. So I encourage every woman, no matter if you have any pathology or not, to go to a pelvic floor therapist to learn about your pelvic floor, to learn how to engage and relax the muscles properly. Not just, we all know how to pull up and hold, but lengthening muscle fibers is equally as important. Think about any joint in your body, it has to lengthen and contract. So we need that full range of the pelvic floor to support ourselves. So learning about that, going for that internal that we just spoke about, where the biofeedback from the therapist will assist you to actually feel what you're doing. Because so many women walk into my rooms and say, oh no, but I do Kegels. I read about them and I've Googled them and I did them the whole way through my pregnancy. And I'm like, how did that work out for you? Like, why are you here? Well, I'm leaking urine. And I don't understand why, because I did my Kegels the whole way through the pregnancy. Or, I've been doing my rehab, and so I don't need to do that side of the therapy. I'm just here for whatever else. And after I explain the pelvic floor and show them and explain how it works, I can see they're sort of thinking, okay, maybe I'm not doing it right. So then they want to do an internal and we do it. And again, the feedback is, okay, I was so off with that. I was not anywhere close to what I should be doing. So are we engaging and activating correctly? Because as I'm sure you know, as a trainer, one of the biggest stumbling blocks for people improving is, are the exercises appropriate for them? And are they doing them correctly? And are they being progressed correctly? Because we often hit a point and plateau. We have to keep strengthening and moving forward and progressing to see those results. And that definitely is something that I encourage patients and women of all ages, as soon as they can and when they're ready, to come in and work with a therapist and then integrate that into the exercises and understand strength training, that, you're not going to turn into a Michelin man if you lift some weights. We can't do that. Hormonally, we do not have the testosterone that men do, and some women are prone to a little bit more muscle bulk than others genetically. But the women that you're seeing with those really intense muscles, there is a lot of supplementation going on behind there, because naturally women don't have that natural testosterone to look like that. So women worry about that because they're like, well, I don't want to be all muscular and all masculine, that's sort of the thing. And you're like, but you're not going to. You're going to build proper strength. You're going to build lean muscle strength and stabilize the system and build that muscle memory, so that once estrogen starts to deplete, you've nurtured and preserved that part of your body or those muscles to just see you forward for better longevity there. So less leaking, less falling, more mobility, less pain, and happier.
I love that. So I'm going to share, I was deciding whether I should share it or not, because it is one of those embarrassing things to talk about. Not so long ago, so actually it was just November, December last year. So it actually is about a year ago. I was training for an MMA fight. It was supposed to be a title fight. And I remember starting, I'd been off for about a year and starting that kind of strength training again. So strength training for a fight. It's slightly different because you're working up to lifting really heavy, like 1 and 2 rep maxes, and then you're going to start to deload again and then move into more plyometric work. And so it was a heavy deadlift day. And I was sitting with this weight. I think it could have been like, I don't know, 140 kilograms or something that I'm not lifting anytime this year. And it was supposed to do my 1 rep max or three reps, something like that. And I peed myself. I lifted that weight and I peed. It was the first time it's ever happened to me. I've been lifting heavy weights for a long time. And that was the moment I was like, and I'm sure it's a chicken egg thing, but at that moment I was like, I am too old to be fighting professionally. Like, if you are going to pee yourself when you're lifting weights, there is a problem. And then I since found out that, even male power lifters, apparently, it's a common joke in the powerlifting space that they actually poop themselves when they lift heavy. So there's clearly a pelvic floor thing that happens with lifting weights. And it was a big realization for me, understanding the pelvic floor to a degree, but only really seeing it in clients of mine with impact. So with jumping, even running, that kind of thing, impact, but not necessarily thinking about it in a lifting heavyweight perspective. So it's a funny story, and people can laugh about it. But I think my question here is, is there a time when certain exercises become counterintuitive for pelvic floor health? Or is it the other way around? Is it more about, you need to keep lifting heavy so that your pelvic floor can maintain that?
So it's actually about pressure. The pelvic floor and its function is actually based on pressure regulation, which people also don't think about in that way. So if you imagine your body as a pressure canister, and we're talking that the diaphragm at the top under the ribs is the top of the pressure canister, the pelvic floor at the bottom is the base. So you've got this dual movement of up and down of your two diaphragms working together. Your deep abdominal muscles like the transverse abdominis create the cylinder around the side, and your deep stabilizers are like your multifidus in the back that help to stabilize the spine. So you've got this beautiful pressure canister of your middle section, and that there's pressure moving through that the whole day, where you cough, you sneeze, you bend over for something, you're at the gym lifting a weight. And basically it's how does that system manage the load that you are putting into the body. So it's about connecting to all those areas. And again, that's why it's not in isolation. So your breathing, what are you doing with your breath work? And how are you, even just breathing is a pressure loading exercise. And I often start there with patients is let's just get the breathing right. So let's make sure we are breathing through our pressure canister and that we are mobilizing our two diaphragms in the right way to send that energy through the body. Then you're looking at a little bit more load. So then how is the core in terms of the abdominals coming in, are you engaging correctly to use your pelvic floor and your transversus to stabilize? So if pressure's coming through, that you are protecting and stabilizing the body. Or are you sucking in your stomach or pulling in your ribs or using your external obliques and overloading those? And my little example I give to patients is, if you look at a balloon and you blow up a balloon, if you were to squeeze that balloon round the middle, thinking you're sucking in your tummy, think of where all that pressure goes. It just gets shunted into the pelvic floor at the bottom and loads on top of the bladder, which is a very vulnerable, neurotic little organ to start with, very emotional. And it doesn't quite like being pushed around. The bladder doesn't like extra stress on it. It's often just deviates slightly. I often describe the pelvic floor as a family living in a house. And you need a good foundation for your family to live well in, and that's your pelvic floor. It's got to move with you. It's got to adapt with you as a family. So it's got to be mobile. It's got to be dynamic. Your bladder is your neurotic, sort of stressed, overactive little person in the house that always needs a lot of attention and support. The uterus and the vagina in the middle is like the mother figure of the house, holds everybody together, creates the life, creates the pleasure, is kind of the middle organ that kind of keeps everything happy. And then your rectum and anus at the back is a little bit like the pushy, bossy, overbearing person in the house. So if you've got pelvic floor dysfunction, it means that one of those systems is acting out. And the pelvic floor is also not regulating it correctly from the bottom. And you're probably getting a lot of external pressure coming from the top. So either chronic coughing, lifting heavy weights, doing a lot of jumping, very stressed and bracing around your tummy, or just basic example, doing completely the incorrect moves in Pilates because you're not being cued to engage correctly. So you're just pushing that pressure down. You're pushing that pressure down, and it's upsetting the apple cart. So we want to make sure that our internal pressures in our pelvis are happy, that we've got the organs are fine, so we don't have constipation in the rectum. As I said earlier, constipation, very common problem with the pelvic floor. So we aren't backlogged in the rectum that's kind of pushing forward onto all the other organs and irritating the bladder, or that we haven't got bladder irritability and it's upregulated and it just wants to wee all the time. And the pelvic floor is not mobile, it's not adaptive, it's not going with that pressure correctly. So it's in spasm, it's tight, it's rigid, and it's not offering that buffer. And then on top of that, you might be coughing a lot, you might be lifting heavy weights, you might be doing all sorts of things that are just bringing more and more pressure into the top. And you can just see how that all kind of derails and becomes problematic. So no, there's never a time to stop a certain exercise. Obviously, there are obvious things like just in terms of your joint integrity and do you have pain? Have you had previous injury? But then you wouldn't be lifting the incredibly heavy weights. You would take it down to the weights that you feel comfortable and keep going with the weights. Keep going with those. I often say to patients, we need to get everybody off the yellow TheraBand. That's not where we start rehab and stop. It's the initial part, and then we got to move on from the yellow TheraBand and actually start playing with weights and seeing what the body can take on. But again, always being aware of that pressure canister. So as you're lifting, are you pushing out into your tummy and creating more pressure? Or are you engaging correctly? Is your posture correct in your back, that you're using your core to channel that through, that the pelvic floor can also be mobile to help, and that we're not just loading onto those organs and causing those issues to come up, which are embarrassing and not very nice, and completely avoidable and workable.
I think what you described so beautifully is this idea of this like canister, like you said. And I've never thought of the pelvic floor in the sense of obvious terms. Yes, you cough sometimes when women are coughing, there is an incontinence. So it's obvious that they're affected. But thinking of it, like you said, this top pressure idea of weights or coughing or whatever that's coming from the top, and how that then impacts the integrity of the bottom. So with just kind of the last few questions as we start running out of time, we've kind of mentioned the idea of hormonal shifts and how those shifts can impact, your daily life, etc. But would there be any practical daily things that you would suggest to any woman kind of starting to think about their wherever they are in their life, whether it's pregnancy or perimenopause, postmenopause, things that they can start doing besides coming to see you, other things that they can do as well, whether it be diet or nutrition or supplementation? mobility work? How do we look after the pelvic floor?
So a big thing for women, and this is an interesting one, and as I've mentioned, constipation, but it is essential for every woman to be having daily bowel movements. If you're not having daily bowel movements and you're straining on the toilet, that is a big red flag that you need to have some intervention and see what's going on there. And that could be from the mechanical side of the pelvic floor, or it could be from your diet. And that then we're looking at getting more fiber in, getting more fluids in, actually eating food. We don't often think of it that way, but in order to make regular poos, you have to be eating enough food. And with the way our world screws things up for us, we think restriction and limiting and not eating is how we control weight and keep things under control. But again, it leads into muscle atrophy, because if you're not reaching your protein levels, you're going to start using your own body supplies. And then also, we're not producing good bowel movements, which means we are not clearing the bowel. We are sitting on the toilet, probably straining a lot. And there's that pressure again, pushing into the pelvic floor. And the older we get and the less estrogen we have to maintain that happy, harmonious, supportive space, that's where we're looking at the risk of prolapse and all sorts of things happening in the pelvis. So on that side, it's healthy bowel movements for that. Also, digested estrogen. So everything in the body turns into waste and it has to get out. And I often say to patients, you would not leave your garbage at the back door for more than 2 or 3 days, because it would make your house stink. It would make you uncomfortable. You take the bags out. The bag's full. You take it out, probably daily. So it's the same with a proper bowel program. Digested estrogen becomes quite toxic, and it's excreted and put into comes into our poo, essentially. And then that needs to go out of the body. Now, if you are holding stool in your rectum and not going to the toilet, apart from one of the reasons of why you get constipated is because fluid gets reabsorbed back into the body, and that's what makes it really hard, and then it's harder to pass it out. That sort of digested toxic estrogen recirculates back into the body. So we are then getting an unhealthy increase in estrogen, in not a nice estrogen, which then goes into bloating, joint pain, pelvic pain, moodiness, all sorts of things that we feel with this toxic estrogen that's coming back into our body. So definitely healthy bowel movements are essential, and every woman should be having those once a day. If you're not, needs to be investigated. To stop sucking in your stomachs. So commonly what we do is we pull in our tummies, we wear high-waisted pants, or we're pulling in, and that's that balloon, that's squeezing the balloon around the middle and all that pressure filling into the bottom of the balloon. So
I'm literally just like deflating my tummy as you speak. I'm like, why are you still sucking it in? Thank you. Sorry, carry on.
Yeah, so to not go around pulling in our tummies. And I often see with patients who come and see me and they've got little lines. If you look at yourself in the mirror and you've got little lines under your rib cage, that is a very big indication that you are overusing your obliques and you're pulling in your tummy. And often why women postpartum say, I've got this little pooch at the bottom, is because they're creating that pressure shift into the lower abdominals by pulling in the tummy, because they've disconnected from their body. They haven't been for a checkup. They haven't done rehab. Their doctor told them they could go back to exercise. They aren't engaging the right muscles. So they start to compensate and pull in around the ribs and upper tummy. And that's what's creating that little push down. And again, extra pressure that we don't need. We don't need extra pressure in our bodies or in our systems. Regular exercise in any way, shape or form, to be doing exercise that you enjoy is really important. If you're not a runner, don't run. Then find the time for something that you enjoy, whether it's walking the dogs in the evening or going for a swim or attending your Pilates class, but try and create some variety and try and get that exercise in. And we know as a standard, it's 150 minutes of moderate exercise a week to 75 minutes of more vigorous exercise a week is the guideline for healthy exercise. And when you divide that amongst 7 days, I think it works out to like 20 minutes a day or something like that. So it's not a huge amount that we need to be doing. And definitely also invest in a little bit of strength training. So lifting those weights, going to someone like yourself who can instruct you. It's hard to go to the gym, and like half the reason I've never done it is because I I felt embarrassed to go and lift weights, thinking, I don't know what I'm doing. I mean, I'm a physio, but I don't know what I'm doing. And then everyone else looks like they know what they're doing, and you feel like a bit of a fool. So, go to a women's only gym, or go to a private trainer or someone that can assist you and teach you, and also give you the right load for your body, and investing in a protocol there. Yeah, and also working on our down regulation of our nervous system, so our fight or flight response. And often with the tummy sucking comes jaw clenching. So we see a lot of patients with like TMD, temporomandibular dysfunction in their TMJs, because they're clenching and holding a lot of tension there. And the two correlate together. Also, it's another interesting connection of the body. So down regulating and making sure that you have proper jaw function and that you are mobile in your jaw literally can help to down regulate the body and have more movement and more stress. Less stress in the body. So yeah, just again, it's very much, eat nicely, drink lots of water, exercise. Everybody always says that, but sometimes it's not as easy for someone to figure out, well, what is that I actually need to be doing? Moving your body, down regulating your stress, good daily poos, and not sucking in your tummy, and lifting a bit of weights. Those would be some of my little basics that women can get going on.
Such like obvious and practical advice, but never have I thought of it in context of pelvic floor. It's always been, yes, I need to eat right. Yes, I need to drink water. Yes, I need to exercise, but not that it can necessarily have other long-term health benefits from a pelvic floor perspective. And then I think what you mentioned around something as simple as daily bowel movements is something that, we take for granted if we are lucky enough to have them every day. We don't think that there are people out there that struggle with it, but my best friend went to the toilet once a week and it was normal for her. And it's nuts for me to think that could be, what your daily life, your daily living is like, and what the long-term impacts could be of not going regularly, both from a pelvic floor health perspective, but also from a body, as you mentioned, toxins that are being reabsorbed into your body.
And also an emotional perspective. We keep circling back to this emotional thing again, but also having a poo, we know, is it's a behavioral thing. It's very behaviorally triggered. And, I have patients who come in, they get very constipated because they go away with their friends for a bush weekend, and they don't poo the whole weekend because they're too embarrassed. And then that just dysregulates everything that they might have built up to have as functional, and then they wonder why they've got these problems when they come back, or it's a build-up effect. Now we're leaking urine, or there's pain, or something going on. But actually it's that behavior and normalizing that and trying to make it more just, I suppose, comfortable in somebody's mind, maybe working through the trauma behind that of why that's happening. So again, just not as simple as, okay, let's sit on a Pilates ball and do a couple of Kegels to maintain our pelvic floor. It goes so much deeper than that, and so many facets, and connects into the body in so many other ways. So I could probably give you 20 things that someone should do every day for their pelvic floor, but we'll stick to those 4 just to start.
So thank you so much. That does bring us to the end of our time. Thank you so much. I really appreciate
That's
this.
a pleasure. No, I really appreciate you having me. Thank you.
The Primal Wellness Podcast.